Dear viewers, the American Cancer Society, ACS, issued new guidelines for lung cancer screening. They now recommend that individuals aged 50 to 80 who are current or former smokers or who have had lung cancer should get a low-dose CT scan annually for lung cancer screening. Previously, the ACS only recommended screening for those who are heavy smokers or who had quit less than 15 years ago. According to ACS Chief Scientific Officer Dr. William Dahut, many people no longer consider themselves smokers because they haven't smoked in 10, 15, or even 20 years. Under the new guidelines, even someone who smoked heavily in the past, quit at 28, and is now 55, should still get screened, regardless of how long ago they quit. Dear friends, the symptoms of lung cancer vary depending on the stage of the disease. In the early stages, a person may have no symptoms or only mild signs, such as a persistent dry cough, coughing up blood, or not responding to medication. It's important to monitor your health, recognize any early warning signs, and seek medical advice promptly. Today, Fash Life would like to share with you the 8 earliest symptoms of lung cancer. Of course, these symptoms could be caused by something less serious, but it never hurts to be cautious, right? 1. Persistent dry cough. This is the most common early symptom of lung cancer. A cough may result from a viral or bacterial respiratory infection, which usually resolves within 1 to 3 weeks. But if a cough persists longer than 3 weeks, you should see a doctor. 2. Coughing up blood, hemoptysis. According to the American Cancer Society, coughing up blood can occur at any stage of lung cancer. If you experience frequent or worsening coughing, especially with blood or mucus, it's crucial to get checked right away. 3. Shortness of breath. Lung tumors can block airways or cause pleural effusion, fluid buildup around the lungs, leading to difficulty breathing and chest pain. Pay attention if you feel breathless during physical activity or even at rest. While this could also signal other respiratory or heart conditions, it's worth getting examined. Wheezing or hoarseness. Wheezing, a whistling sound while breathing, can occur when airways are restricted due to inflammation, obstruction, or constriction. While common in asthma and allergies, it can also result from lung tumors. Hoarseness can be caused by colds, flu, or laryngitis. But if it lasts more than 2 weeks, take it seriously. Tumors can press on the recurrent laryngeal nerve, causing vocal cord paralysis, leading to noticeable changes in voice. 5. Chest pain. When lung cancer spreads to the lymph nodes or invades surrounding structures, it can cause chest pain. This pain might be sharp or dull, constant or intermittent, and may worsen with deep breaths, laughing, or coughing. 6. Unexplained weight loss. Sudden, unexplained weight loss, especially 4 to 5 kilograms, 8 to 11 kilograms or more, can be a warning sign not just of lung cancer, but of many cancers. It may result from loss of appetite, fatigue, or direct effects of a tumor on metabolism. Whatever the cause, get checked if it happens. 7. Frequent respiratory infections. If you often suffer from bronchitis, pneumonia, or other chronic respiratory infections, it may be due to an underlying issue like lung cancer. In such cases, X-rays or other imaging tests may be needed for further evaluation. 8. Pain in the shoulder, arm, or fingers. Bone pain, especially in the shoulder, arms, or fingertips, might be mistaken for a strain or injury. However, if it occurs suddenly and is unexplained, it could result from inflammation, arthritis, or potentially lung cancer. Tumors at the top of the lung Pancoast tumors can invade the chest wall and press on nerves, causing pain in the shoulder, arms, and hands. If the tumor spreads to the spine or ribs, it can lead to back pain. In some cases, lung tumors may press on large veins that return blood to the heart, causing headaches or migraines. Dear viewers, if you experience any of these symptoms, please consult your doctor. It's best to rule out lung cancer early. Even if it's not cancer, catching other conditions early is key. Tests for lung cancer include chest X-rays and low-dose CT scans. Prevention is better than cure. We should all take steps daily to nourish and detoxify our lungs and strengthen our immune system. Here are 5 habits to keep your lungs healthy. 1. Quit smoking. Tobacco smoke contains toxic chemicals that severely damage the respiratory system. Nicotine paralyzes cilia, the tiny hairs that help clean the lungs, leading to toxin buildup, chronic coughing, and diseases like lung cancer, asthma, emphysema, and chronic bronchitis. If you smoke, quitting is the first and most important step. 2. Improve your diet. Eat plenty of fruits and vegetables, especially those good for lung health, such as blueberries, raspberries, apples, plums, citrus fruits, leafy greens, and bell peppers. Also consume water-rich produce like watermelon, cucumbers, and tomatoes. Avoid red meat. Choose skinless poultry rich in vitamin A, which helps protect lung tissue. Fatty fish like salmon, mackerel, sardines, and herring are rich in omega-3 fatty acids, which are anti-inflammatory. Include legumes like black beans, kidney beans, and lentils. Avoid processed and packaged foods. 3. Stay hydrated. Drinking enough water daily helps flush toxins, keep the airways moist, and reduce mucus buildup. A sign of good hydration is light yellow urine. If it's dark yellow, you need to drink more. 4. Exercise regularly. Exercise increases blood flow to the lungs, which improves oxygen intake and expels carbon dioxide. Recommended activities include walking, jump rope, swimming, and cycling. Aim for at least 30 minutes of moderate exercise 5 days a week. Start slowly and increase intensity as your body adjusts. Breathing exercises can also help. Pursed lip breathing. Inhale through your nose for 2 to 3 seconds, then exhale slowly through pursed lips for 4 to 9 seconds. Repeat 4 to 5 times. Diaphragmatic, belly. Breathing. Place one hand on your abdomen and one on your chest. Breathe deeply so that your stomach rises, not your chest. 5. Lung cleansing teas. Honey plus warm water, simple yet effective for reducing inflammation and cough. Hawthorn tea helps clear airways and supports heart health. Avoid if you're on heart or blood pressure meds. Green tea, anti-inflammatory and rich in antioxidants. A 2018 study from Kyunghee University in South Korea found that people aged 40 plus who drank green tea twice daily had a reduced risk of chronic lung disease. Thyme tea, antibacterial, anti-inflammatory, reduces cough. Avoid during pregnancy. Ginger cinnamon tea strengthens immunity, clears lungs. You can add lemon or honey. Drink in the morning for better absorption. People with stomach ulcers should use caution. Thank you, dear viewers. That concludes today's episode of Healthy Living Every Day by Flash Life. We appreciate your time and attention. Goodbye and see you again.